Why are you always sleepy? 9 non-obvious reasons for pronounced daytime sleepiness: lack of sleep, poor nutrition, disrupted sleep schedule, alcohol. Honestly, I'm already tired of talking about these reasons for fatigue, exhaustion, and sleepiness. I'm sometimes criticized for consistently repeating the same message. And today I decided to talk about the less obvious causes of sleepiness. But they are no less important and can sometimes significantly worsen your quality of life and in general even affect your life expectancy. Watch this video until the end and I'll share an interesting way to deal with daytime sleepiness. Reason number 1, iron deficiency. Often, just by talking to a person, we can't simply determine this cause. Well, of course, if a person already has anemia, their hair is falling out, their nails are breaking, and they're sitting in front of us looking pale, then yes, we'll suspect it. But even a hidden iron deficiency, when the iron level itself is still normal, but ferritin, which is a protein that shows the iron reserves in the body, is low, can already lead to sleep disturbances. And this, in turn, can cause fatigue, tiredness, and drowsiness. The thing is, iron is involved in the synthesis of dopamine, and this is a substance in the brain that regulates a lot of different functions, including in particular our sleep. By the way, that's exactly why tests for iron and ferritin are included in the standard set of different parameters that we check in the blood when we consult a person with sleep disorders.
Is it true that women suffer from iron deficiency more often?
That's true, but they have complicating factors, especially regarding pregnancy. The thing is, usually when the fetus is actively developing, they have an increased need for iron for the baby. And this in turn can lead to iron deficiency and the development of iron deficiency anemia. Actually, iron deficiency in pregnant women often causes what's called restless leg syndrome, which is also due to iron deficiency, and the woman's sleep quality can be significantly affected. By the way, there's a link to a video about restless leg syndrome on my channel. Take a look. It's also a rather specific sleep disorder that worsens sleep quality, leads to unrefreshing, shallow sleep, and in particular can also cause excessive daytime sleepiness. The second reason is narcolepsy. It's a very specific condition. Yes, it's quite rare, but I do have to consult patients with it. And unfortunately, they go to a huge number of doctors who can't figure out the cause of their sleepiness. There's a saying, try not to sleep for 3 days, and you'll understand how a patient with narcolepsy feels after 8 hours of being awake. The disease manifests with several symptoms. The first is severe daytime sleepiness. A person periodically needs to lie down and sleep about every hour and a half to 2 hours for 15 to 20 minutes. If he sleeps, he feels better. But again, after an hour and a half to 2 hours, he needs to sleep to recover. The second is so-called cataplexy. When a person experiences strong emotions like fear or laughter, he can suddenly fall, his muscle tone decreases or is lost, and he can even fall asleep. As strange as it may seem, he falls and falls asleep. This is a specific type of narcolepsy. The third is sleep paralysis. That is, a person may wake up but can't move. This is also a specific manifestation of the disease. By the way, I also have information about sleep paralysis on my channel. And the fourth is so-called hypnagogic and hypnopompic hallucinations. Hallucinations that occur when falling asleep and when waking up. That is, on one hand, a person feels that they sense the room they're in, but on the other hand, there are already some sounds and images. People, animals, monsters, etc. And this symptomatology is quite characteristic of narcolepsy, but I want to emphasize again that one of the cardinal symptoms of this condition is extremely pronounced daytime sleepiness. The third cause is hypothyroidism, a decrease in thyroid function. Even subclinical decreases in thyroid function can lead to fatigue, weakness, and sleepiness. And in particular, a thyroid hormone test is also part of the standard examination for patients with sleep disorders and daytime sleepiness. Fourth, chronic fatigue syndrome. That is, when we see a person who is tired, exhausted, and this lasts for at least 6 months. And in particular, he experiences sleepiness. But we don't find any other serious causes, which, by the way, we are talking about today. And often this is a diagnosis of exclusion when a person is sleepy, but in general, it is impossible to find any specific cause. And in this sense, I would say that modern people often feel tired, exhausted, and sleepy, which can't really be explained by any medical problems. By the way, if you also feel sleepy, tired, and exhausted, and no one can really figure out why, give this video a like. Fifth, depression. Note that this is a very broad diagnosis. There are different manifestations of depressive states, different types of depression, but some types of depression are accompanied by obvious drowsiness. There are these sluggish, if I can put it that way, types of depression. When a person constantly doesn't want anything, they have apathy, decreased strength and energy, and they may subjectively feel not so much drowsiness itself, but more fatigue and exhaustion. The person says, yes, I try to lie down, yes, I even try to fall asleep, but maybe it doesn't always work out for me. And here, sometimes it's necessary to differentiate between fatigue, exhaustion, and lack of energy in a person and actual drowsiness. I already said that depression is quite a multifaceted illness. On one hand, anxiety and depression can cause insomnia, and on the other hand, insomnia itself is a lingering condition that can worsen depression in particular. In this sense, it's extremely important to understand this whole tangle of problems and to treat the person properly. And in particular, of course, by paying attention to chronic insomnia, I implement programs for diagnosing and treating chronic insomnia. I use methods of cognitive behavioral therapy for insomnia, and I cure most patients with chronic long-term insomnia, precisely because we first focus on identifying the causes of sleep disorders and address the root cause. Or, if we see so-called conditioned non-organic insomnia, we use cognitive behavioral therapy methods, which also allow us to effectively deal with this type of insomnia. In the description of this video, you can find a link to my insomnia treatment program. Feel free to reach out. I can help you effectively. 6. Consuming large doses of caffeine. It might seem like a rather strange situation. I'm discussing caffeine and its effects on fatigue, exhaustion, and drowsiness, even though it's meant to energize you. Here, a certain problem arises with caffeine consumption. When we first start using it, and in small doses, and not very often. Yes, indeed, it works as a stimulant and has an effect on our nervous system. But if a person starts consuming it often and in large amounts, and usually that's more than 5 or 6 times a day, then caffeine itself actually stops stimulating the nervous system. But if we don't consume it, we immediately experience sharp fatigue, exhaustion, and drowsiness. So it turns out there's a good saying. At first the person uses caffeine to feel good, and later just so they don't feel bad. Moreover, when a person goes to bed at night, wakes up in the morning, and the caffeine has been washed out, they wake up with a caffeine deficiency. They feel exhausted, fatigued, and can hardly keep their eyes open. And basically, what does he need to do? He needs to have, 1, 2, or 3 cups of coffee or tea again to somehow get himself together. So paradoxically, if there is a dependence on caffeine and large doses are consumed, this leads to the fact that a person quite often feels tired, worn out, and sleepy, especially in the morning when there is a lack of caffeine.
Yes, we're talking about coffee. What do we mean? It's a shot, an Americano, or an espresso. For instance, RAF coffee has very little actual coffee, so I can drink liters of it.
Well, to say that there's no coffee in RAF, that's not really true. Almost all the drinks there, like cappuccino and cappuccino with milk. Yes, milk doesn't destroy caffeine at all, actually. So, well, you can find out how much is in each specific drink, but almost all types of coffee contain caffeine. Yes, for example, different types of coffee may have slightly different amounts of caffeine. It could be a single double espresso or something like that. But one serving that you get usually from a coffee machine, or for example, vending machines that make those special, what are they called? Capsules. Yes, basically, that's considered one serving. Well, if we're talking about tea, then it's 1 tea bag, although of course some people like to brew very strong tea, loose leaf, and so on. There can be even more caffeine in that than in a regular tea bag, for example, but it's a bit harder to determine. Usually doses are counted as 1 tea bag, 1 spoonful, 1 capsule, or 1 shot from a coffee machine. 7th, Kleine-Levin syndrome is also a rare condition, although I do see such patients from time to time, mostly. This is more a psychiatrist's job than a sleep specialist's. But they come to me with hypersomnia, with excessive daytime sleepiness. This happens more often in young people, mostly males. It can also be accompanied by hallucinations, hypersexuality, and behavioral disorders. In general, this is more of a psychiatric situation. But again, one of the symptoms of this condition is episodes of pronounced daytime sleepiness, which can last from several days to even several weeks, when a person can sleep almost around the clock. Then it passes, the person more or less returns to normal, but it's a cyclical situation that generally requires the attention of psychiatrists and appropriate treatment. 8 is diabetes. There's even a term called diabetic fatigue syndrome. Sometimes a person with diabetes or even pre-diabetes starts to feel tired, exhausted, and drowsy. Surprisingly, in modern medicine, diagnosing diabetes is not difficult at all. In fact, it's extremely easy. Well, because you just check blood sugar and diagnose diabetes, right? Or you can use glycated hemoglobin. But I'll tell you, there are people who just don't like going to doctors and never get any tests done. And even I get some pretty decent patients who say, "Doctor, I just don't like getting checkups." The last time he had blood tests was 10 years ago, and now he already has classic symptoms of diabetes, he already has diabetic foot problems, his legs hurt, and he has a dry mouth. We check his blood sugar and it's 10 or 15. You can really let yourself go that far. Although, I'll say it again, diagnosing diabetes is actually pretty simple if you at least have regular medical checkups. But again, one of the symptoms of diabetes, even in its early stages, can be pronounced fatigue and drowsiness. And the next thing is sleep apnea or obstructive sleep apnea syndrome. Actually, this is a condition that is quite common, by the way, probably the most common of all the ones I've mentioned. But maybe except for the fact that a person also actively consumes caffeine. 15% of adults have some form of clinically significant sleep-related breathing disorders, and about 5 to 7% of the entire adult population suffers from severe forms of sleep apnea. This is a condition that is accompanied by loud snoring, gasping, and pauses in breathing during sleep. Shallow, restless, and unrefreshing sleep, frequent nighttime urination, night sweats, high blood pressure, and headaches at night and in the morning. But another key symptom is severe daytime sleepiness. Sometimes a patient comes to me for a consultation, he sits in front of me, talks to me about something, I start telling him something, and he just sits there and starts falling asleep right in the middle of the conversation. And sometimes, unfortunately, patients come to me already with severe apnea, with severe daytime sleepiness, but sadly undiagnosed. Unfortunately, there still aren't many sleep specialists in Russia, and doctors don't really know much about sleep disorders. They receive information about it back in medical school, and there are quite advanced cases which, in addition to sleepiness, of course, also have some cardiovascular, neurological, and pulmonary complications. But again, if your sleep is not refreshing, if you snore loudly, that's already a reason to see a sleep specialist, undergo the necessary examination, and get the correct diagnosis. So, how do you treat apnea? If it's a severe case, especially in patients who are overweight, then some rather unusual devices are used. That's the topic of my doctoral dissertation, by the way. I have about 8,000 patients who sleep with these special devices. Here you see a picture on the screen where I'm working with such a patient and they sleep in these interesting little masks. And here there's also a tube connected to the device. And this, strangely enough, allows a person to get a really good night's sleep because it almost completely eliminates breathing disorders during sleep. But once again, it's the patient's responsibility to suspect they might have apnea, or their doctors, and to refer them to a sleep specialist to undergo polysomnography, computer somnography, make an accurate diagnosis, and prescribe effective treatment. And if you experience drowsiness either periodically or constantly, have you tried to find the cause to deal with it or to consult doctors, and what did they find? Please write in the comments or maybe ask your questions and I'll try to help you figure out the causes of your drowsiness. And we'll discuss this in the comments to this video. And I also promised you an interesting way to deal with daytime drowsiness. Well, of course, considering that I listed a lot of illnesses, it's better to see a doctor and figure out the reasons. But if the situation requires you personally to have maximum concentration on a specific day and to take some action yourself, what can you do? Drowsiness, as a rule, is not constant. It usually comes in waves every hour and a half to 2 hours. Well, for example, even just with ordinary lack of sleep. And if during those 15 to 20 minutes, when a wave of drowsiness hits, you just sit there suffering and thinking, what a nightmare, I really want to sleep, I'm just going to nod off here. Around 90 to 120 minutes later, drowsiness returns. You'll be sitting there nodding off again, so you'll feel like you spent almost the entire day just nodding off. But what can you do? If a wave of drowsiness comes over you, try to give yourself some physical or mental activity. Well, for example, just walk around the floors, call your subordinates and scold them, go see your boss and let him scold you. That is, in general, try to spend those 15 or 20 minutes actively, with the understanding that in 20 minutes the wave of drowsiness will pass and you'll have an hour and a half during which you won't feel pronounced drowsiness. And so, if you give yourself this kind of periodic activity during moments of drowsiness, you won't have the impression that the whole day is wasted and everything is terrible. You were unable to work and always wanted to sleep. This is how you can get through these waves of drowsiness by giving yourself physical or mental activity. On my channel, you can learn more interesting and useful information about how to improve your sleep, about sleep hygiene, bedroom hygiene, sleep disorders, their diagnosis and treatment. Subscribe to my channel and don't forget to click the bell so you don't miss my new interesting videos.